Dear Dr. Kunirova and colleagues, thank you for inviting me and congratulations on your first National Congress on Palliative Care for Children and Young Adults. It's a great honor to speak with you today and know that you're part of our global movement to envision and create a world without serious health-related suffering. I'm Dr. Catherine Pettis, the Senior Advocacy and Partnerships Director for the International Association for Hospice and Palliative Care, or IAHPC. The IAHPC is a global membership organization in official relations with the World Health Organization and in consultative status with the UN Economic and Social Council. We have more than 1,000 members in many different countries, all these red dots, and 3 in Kazakhstan. And you can see every country when you click on the dot, you can see who the members are. We have 4 pillars of work: education, advocacy, research, and information dissemination. I specialize in advocating for improved, safe availability of palliative care medicines in the framework of national drug laws and in raising awareness with faith communities about the importance of palliative care. Please let me know if you would like me to help you with any of those topics. We have many membership benefits. In general, you can participate in our research projects, you can apply for scholarships, you can serve on our delegations to the multilateral meetings, and we have many courses, some of which are just available to members. We have advanced pain and symptom management, basic pain and symptom management. We just had a course in the care of people with neurological conditions. And just sign up, have a look at our website if you scan the QR code and see all the different benefits that you can get from becoming a member. Because Kazakhstan is an upper middle income country, it costs $95 for a year and $140 for institutions, which allows 3 of your members of institutions to benefit from all our different benefits. So I'm going to start with the IAHPC definition of palliative care, which is actually a consensus definition. Hundreds of people from all over the world between 2016 and 2018 created this definition, which is built on the WHO definition, which is actually more than 20 years old. So this definition shows that palliative care is the active, holistic care of individuals across all ages with serious health-related suffering due to serious illness, and especially those near the end of life. It aims to improve the quality of life of patients, their families, and their caregivers. And there's a part of the definition, just like the WHO definition, that talks about how governments can integrate palliative care into policies. So you can read this slide. I'm not going to read it all for you, but number 3 says, ensure access to essential medicines for pain relief, including pediatric formulations. And then number 5, ensure access to adequate palliative care for vulnerable groups, including children and older persons. So you can see that you have to have policies and norms to be able to do that. Insurance plans need to cover it. And you have to ensure that palliative care, including for children, is part of all healthcare services. And in 2024, this year in March, the Commission on Narcotic Drugs, which is a UN body in Vienna, adopted Resolution 67-2, which was promoting awareness raising, education, training, and data collection as part of a comprehensive approach to ensuring access to and availability of controlled substances for medical and scientific purposes, that's pain relief medicines, including for the treatment of children. So it's specially emphasized children and ensuring their rational use. This resolution was in large part due to the advocacy of the International Association for Hospice and Palliative Care and our partners, and it's up to member states such as Kazakhstan to implement the resolution in your country and then report on it in forthcoming sessions of CND. And it says that you have to remove the existing barriers to medicines, legislation, regulatory systems, healthcare systems, and training of healthcare personnel in order to make this work. And that's where, the IAHPC can help you do that, especially with our courses. There are many spiritual, moral, economic, and political benefits that will come to Kazakhstan from integrating children's palliative care into your health system. As always, though, civil society organizations, your palliative care associations have to take the lead. The evidence now shows that palliative care for children, along with curative care, saves lives. Children where palliative and curative care are available for children with cancer, they survive and they live longer, happy lives. So it also saves money, for public money, by preventing unnecessary futile treatments as well as hospitalization if you have good palliative care at home. It builds family and community happiness and therefore public trust. And with public trust comes votes and political stability. So that it's a win-win situation. And the evidence now shows this. It's not me just saying this. And of the many thousands of children who need palliative care in Kazakhstan, only a tiny portion can receive it, since the pediatric palliative care system has only 84 beds in 15 medical organizations. Those who do not receive palliative care, that's the vast majority, suffer at home in the loving but very much suffering care of parents and grandparents and family members. But loving care is not enough to relieve the symptom burden of complex medical conditions. Family caregivers are mostly women. Many of them are older women. And when they don't have the support they need, they suffer serious mental health and physical consequences, along with financial consequences, because many of them, of course, have to give up their jobs. Home-based palliative care and payment of a basic stipend could greatly ease caregiver burden and increase productivity for women, helping Kazakhstan meet several important sustainable development goals, including Goal 3, better health and well-being, and Goal 5, gender equality. It can also improve education and employment for women. These are very important parts of the 2030 Agenda for Sustainable Development that Kazakhstan will be reporting on at the UN. So I realize that you're probably doing many of the things I'm going to recommend, so I'm just endorsing what you're already doing and what you already know. But educating yourselves about palliative care, building partnerships, raising awareness, developing training programs, and improving professional standards, as well, of course, as advocating for policies, will make every day a hopeful day for children with serious illness, which is the theme of your conference. So finally, thank you. I was blessed to come to your beautiful country in 2018 for the Astana Conference on Primary Health Care. The final document included palliative care because of our advocacy, and I'm always here to support you with IAHPC. So please join us and have a wonderful conference.